there's a challenge in our world right now. Not enough people to care for mental health. And certainly patients with rheumatoid arthritis frequently experience issues with mental health. How do we get around this? How do we manage this?
So the really good news is that most people will do fine with a little bit of support. And by that, I say 60% or more. We saw this in the CATCH data. We looked at how people were doing, for instance, prior to the pandemic, and then we all got hit with COVID-19. And didn't that turn our worlds upside down? And so what we saw is that, at least in our patients, 60%, yes, they had that initial upset. We saw anxiety go up, we saw depression go up. We certainly in Canada saw those things spike each time we had a new wave, but things returned quite quickly. And so when we looked at how they were doing in terms of their mood, about 60% actually fell into what we called the resilient group. They did just fine. Yes, of course, they reacted to what was going on, but then life fell back into place. The next largest group was the 1 in 5, and those are the ones that seem to pay the price over time. They initially seemed to be responding well, but by the end of 2 years, the first 2 years of COVID, what we saw was there was a bump up in the proportion of people that were now who we would classify as depressed or anxious and would benefit from some kind of treatment.